Hi, welcome back to the Progressive Front. My name is Trish. Today we're going to talk about the Affordable Care Act, also known as Obamacare, and why Republicans are trying to repeal it. We here at the Progressive Front feel that some people are a little bit misinformed about what exactly the Affordable Care Act is and why repealing it might not be a good idea.
These government shutdowns have happened before. The last one was in 1996. But the debate on this one is particularly heated because people have such strong opinions about Obamacare. Interestingly, the polls show that most Americans say they don't like Obamacare, but they love what's in it when it all gets broken down. It's like the opposite of a McNugget. So it's interesting. And when there are complicated issues to study, most people just side with whoever they usually side with. So I decided to conduct an experiment today. We sent a camera crew out on the Hollywood Boulevard to ask people which they thought was better, the Affordable Care Act or Obamacare. Now, as you may know, Obamacare is just a nickname for the Affordable Care Act. They're the same thing. But lo and behold, we found people who did not know that, and that didn't stop them from weighing in on it.
We're talking about health care today, and which plan do you support, Obamacare or the Affordable Care Act?
The Affordable Care Act.
And what is it about Obamacare that you do not like?
I just think that there's a lot of holes in it, and it needs to be revamped. I think
and you think
hasn't been thought out.
You think the Affordable Care Act is a better plan than Obamacare?
Better, but I'm not happy with that either.
What do you agree with, Obamacare or the Affordable Care Act?
I'm more towards the Affordable Care Act, but I'm also very sympathetic for people that don't have the ability to have proper medical insurance.
So the Affordable Health Care Act is still a better option than
Yes.
Obama?
According to a poll recently conducted by the New York Times, 35% of Americans aren't aware that Obamacare and the Affordable Care Act are in fact the same thing. The main idea behind the Affordable Care Act, making health insurance affordable and available for all citizens, actually began life in 2006 in the state of Massachusetts under Governor Mitt Romney. The statewide healthcare reform, called Romneycare, caught the attention of the Obama administration years later. After a few revisions, the Affordable Care Act was put into effect by President Obama. The reform was almost identical to Romneycare, except in terms of scope and Medicaid expansion. This was introduced by Obama as a compromise with Republicans, who responded like this.
All right, well, I mean, I think a lot of people said that, you weren't going to be able to keep your health care, but also, I think they focused on the death panels, which will be coming. Call them what you will. Rationing is part of it. And
I agree. It's huge. It's going to be a huge issue, and that's something else about which the president was not fully forthcoming and straightforward.
All right, so you believe that there will be rationing, aka death panels?
It's built into the plan. It's not like a guess or like a judgment. That's going to be part of how costs are controlled.
Yeah. Okay. Well,
but I'll say something else about that issue, which is we do need to do some of that in this country because we can't afford to spend so much on end-of-life care. A very high percentage of our health care spending is for a very small number of people at the last stages of their life. I'm not saying the system shouldn't allow that, but there's too much cost there. Judgments have to be made. We have to society.
Made by who, Mark? Mark, made by who? The government?
By individuals.
But it's not going to be made by individuals. If you say it's included in the health care.
It's not now. It's not now for many people who have insurance. Their insurance companies make those decisions.
But it's very rare that in other words, if someone needs a bypass, the insurance company doesn't say put him in a hospice or give him a pill like Tom Daschle told me that he would do. I mean,
sometimes people run up against caps and costs with their insurance that make it impractical to get certain kind of coverage. But don't draw me into a false argument here about what I'm saying. All I'm saying is, as a society, we need to have this discussion in an honest and straightforward way because we can't afford every instance that people would like to have.
Total bullshit. Obamacare is not perfect. Premiums are far too high for consumers, and in many ways, it was a gift to the insurance and pharmaceutical companies. If Republicans want to talk about socialized medicine, perhaps they can start with the billions given each year, approved by Congress even before the Affordable Care Act, to these industries in the form of subsidies. Businesses who profit off of sick people don't need more money from us. The Affordable Care Act, in essence, was two pieces of legislation: the Patient Protection and Affordable Care Act and the Health Care and Education Reconciliation Act. These two effectively made denying coverage based on pre-existing conditions, in other words, making people die because they're too expensive to insure, illegal. The measures also expanded Medicare and Medicaid coverage to the elderly, children, and low-income households. Obamacare subsidized insurance to millions of Americans who would not have been able to afford it. For young adults already saddled with significant college debt and working low wages, it allowed them to remain on their parents' insurance plans for longer. Again, while not perfect, Obamacare has the highest enrollment in areas that voted for Trump in the 2016 election. States like Texas, North Carolina, Georgia, and Pennsylvania all have high enrollment in Obamacare. Talk about voting against your own interest. In red state Kentucky, as reported by the Lexington Herald-Leader, up to 45,000 jobs could be lost under an Obamacare repeal and would lead up to $40.6 billion less in business output, and the loss of $718 million in state and local taxes. Leighton Koo, director of the Center for Health Policy Research, has stated, repealing key parts of the Affordable Care Act could trigger massive job losses and a slump in consumer and business spending that would affect all sectors of state economies. John Kasich, the former presidential candidate and current governor of Ohio, has given his opinion of repealing Obamacare by saying, "There's room for improvement, but to repeal and not to replace. I just want to know what's going to happen to all those people who find themselves left out in the cold." Kasich went on to say, "Let's just say they got rid of it and didn't replace it with anything. What happens to those 700,000 people? What happens to drug treatment? What happens to mental health counseling?" Flat out repealing Obamacare is deeply unpopular with the public as well. Senator Bernie Sanders, in his most recent debate about healthcare reform, stated, "The overwhelming majority of the American people say, do not simply repeal the Affordable Care Act, make improvements." According to a survey done by the Kaiser Family Foundation in December 2016, only 26% of Americans want Obamacare completely repealed. Now, let's take a look at what House Speaker Paul Ryan and the GOP suggest while they move forward with the repeal.
We have a plan to replace it. We have plenty of ideas to replace it, and you'll see as the weeks and months unfold what we're talking about replacing it. How we can get better choices with lower prices by not having a costly government takeover of healthcare, which is causing all this problem in the first place.
So essentially, they don't have a plan. Get rid of it. Whatever. They don't care. One potential action they have is to repeal and delay. That is, one idea floated by the GOP is to repeal the Affordable Care Act and hold off until 2020 until it takes effect. Rand Paul, a libertarian congressman, has advocated against this, saying, "I think it's imperative that Republicans do a replacement simultaneous to a repeal." It is notable that Rand Paul actually voted against the beginning of the repeal. All Democrats voted against it, all except Dianne Feinstein of California. If you're in California, you need to reach out to her immediately and demand to know why she abstained from voting. There is another good reason why the GOP might not want the repeal to take effect right away. They don't want to have to face their constituents, who they took health coverage away from when they had midterm elections in 2018 and another election in 2020. In other words, they're cowards. Regardless of how this happens, the repeal of the Affordable Care Act will happen unless we make it clear we don't want it to. Included below is a link to contact your congressional representatives. Call, email, or write to them and let them know it is beyond cowardly to repeal and delay. The louder our voices, the more we can push for change and to protect our rights. Thanks for watching. I'm Patricia Hodges, reporting for the Progressive Front. Please hit share, subscribe, and find us on Facebook.